The biggest investment goes in primary schools and secondary schools, the ordinary ones. I think healthcare givers, the schools for healthcare givers are not so many, yet we need them a lot. The ratio is still very low in Uganda. Patient to nurse, patient to midwife, patient to doctor even. So we need more of these, and if other interested people would like to invest in this area, I think we should have a duty to support them, like we're trying to support you now. We welcome the idea of a partnership with the kingdom, and we partner with different people in different areas. But we are very systematic. You can even call us bureaucratic. But in a big institution, you need a little bit of bureaucracy to avoid, pitfalls. If you don't embrace bureaucracy, you can experience pitfalls which can injure the partnership or the collaboration. So here, this is how we move briefly. We welcome a written proposal for a partnership, which highlights the extent of the collaboration that you expect from the kingdom. When we get it, because yours in the area of health, when I receive this proposal, I pass it on to the minister in charge of health. She's on leave right now. And the minister of health, she's got professionals, he's one of them. They look through it. If they think it contains relevant themes to our own health care that we provide in the kingdom, we'll pass it on to a unit called BCAL. BCAL is a unit which examines partnerships. Some partnerships are commercial in nature, others are not commercial in nature. Yours is not commercial in nature. But then there is a unit that deals with that. They look through it to study what you propose to give and us to give in exchange. Once BCAL thinks the proposal is worthwhile, it is sent to the Buganda Royal Law Chambers. We've got a team of lawyers here. They're headed by the Kingdom's Attorney General to look for legal loopholes, ensure that we're operating within the law. The people we are dealing with, it's good you came with your certificate of registration, all these things. We examine them. Then after that, the Attorney General advises that everything is good. The proposal is brought to a cabinet session. And then the minister presents it. And then after cabinet believes that the collaboration is will benefit the kingdom, we invite you for signing of the memorandum of understanding. That's how we operate. A little bit of bureaucracy, but since you follow me, like you said, you are not likely to hear scandals around us here. Scandals and all these things, no. We don't do that because we are a little bit careful how we move. So, you know what to do now. Send a proposal. The proposal will be forwarded through all these channels. I don't decide. I'm a lawyer, I'm sure you know this, but I don't look at the legal loopholes because there is somebody whose job it is to do that. I superintend everything else. So I don't decide. I don't say, Dr. Reg speaks very well, we must go with him. Or Dr. Reg works with Birimye Matovu, we go with him. No, I don't. That will come from the recommendations of other members of the team we have here. I'm sure you appreciate where we are coming from. Every time we all say that the biggest gift to anybody from God is health. It is life. Life depends on health. We say this all the time, and it is true. It is very true. In all we do, in all we aspire to achieve, all of that is dependent upon one's state of health. So the minister talked about the significance of health within the heritage of Buganda. We had, in the past, hundreds of years back, clans were assigned duties to ensure good health for the people in the kingdom. When you come across a member of the Ngeye clan, I think Ngeye is the Colbus monkey. If you met anyone, those who are responsible for the health of the subjects of the king, and their leader, Omutaka Kasuja, was the Surgeon General. You hear of Surgeon Generals these days in different countries. And many others. So health is of great significance, because I think even in the past, all leaders realized that if the communities were not healthy, you wouldn't be able to fight wars. You wouldn't be able to reproduce. You wouldn't be able to grow food or to herd cattle. So it's very significant to prioritize health. And that's why healthcare providers are very, very significant for the social and economic transformation of any country. The need to have well-trained healthcare providers cannot be overemphasized. I think the two most important professions, in my opinion, are healthcare givers and teachers. Everything else is secondary to those two. You could even say teachers are number one, because even healthcare givers must be taught by teachers. But then the healthcare givers ensure that we are in a good state of health to carry out the activities that bring meaning to life. That bring meaning to life. There is nothing like being so successful when you are in a poor state of health. If you've got so much money, you've got a big house, maybe as big as this complex, how are you going to stay in it comfortably if you're not in a good state of health? If you've got so many cars, how are you going to drive them? If you've got so much food, how are you going to eat it? How are you going to enjoy it? So the need to care for our health cannot be overemphasized, because it should be obvious. And I like the motto of your school. I've just read it here. Building a reliable workforce for health. Health requires health enablers. The enablers are the individuals themselves, but also the professionals. We need well-trained professionals, the nurses, the midwives. You talked about the ethical conduct of nurses and midwives. You know, the tenderness you receive from the healthcare giver is medicine itself. If you go to a hospital and the nurse handles you very well, you feel as if the healing process has started. So it's very important to have well-trained professionals, people who understand that providing healthcare is a calling. It's comparable to priesthood, because you must love it with your heart, you must love it with your soul, with your mind, to ensure that somebody recovers from whatever ailments one may be suffering from. And I hope that this is how you train the healthcare givers that go through your hands. I commend the founders, the proprietors of the school, for investing in a school for training professionals in healthcare giving. Hey. Thank you very much. Uganda, oh!